browser there. Also, you can go to All County Healthcare's website to see past episodes. And if you have any healthcare questions, please call 1-888-717-7170. Ask for Maddie. She will be happy to answer all of your home health questions. And I'm really excited tonight to have a cardiologist who's been in this area for the last few years on the program tonight. Because as you know, in South Florida, we've had a wild week with Hurricane Irma and all that's been going on. And I think I have to ask the doc, but man, my heart has been just going crazy this week. And there's a couple times I had to stop myself because I was a little concerned, but we'll talk a little bit about that. But I want to welcome to the program Dr. Jonathan Vafai. Dr. Vafai, how you doing tonight?
Doing great. How are you?
Great. Thank you. And thank you for coming on the program. Let's start out first with the hurricane. Where are you a resident of, and how'd you do during the storm?
Me and my family, we live in Delray Beach, and we did pretty well. We lost power, but I had a generator, so we were able to get through the storm really unscathed. No major damage to my house, and my office, we got our power back a couple of days ago, so things are getting a little bit closer to normal.
And that office is also in Delray, because I know it's in a very nice area. I drive by it on my way to work. Tell us about it. It's South Florida Heart Institute. You're on, is it Lake Ida Road and Via Flora?
No, it's on Military Trail. It's 5035 Via Delray.
Via Delray, that's it. Sorry about that.
Okay, we have our own building, and there's 6 doctors, 6 of us there, and we also have an electrophysiologist that does some office hours with us. So we're all part of Tenet and take care of a large number of people, anywhere from Boca Raton, even some people in Broward, all the way up through Boynton Beach.
I know you're a very busy office. Like you said, 6 cardiologists. That's just amazing to have on staff at one site. And I know you guys are on the top floor there, but you do, this is one of my questions I'm knocking out early, stress testing on the bottom floor, and is it echocardiography on the bottom floor?
Yes.
Wow.
So we're pretty full service as far as non-invasive cardiology goes. So we see our patients mostly upstairs, and downstairs we have an office as well where we'll do office visits. We also have an echo lab where we can do what are called transthoracic echoes, so echoes outside the body, and various tests related to that, as well as stress tests. So we do regular stress tests and what are called nuclear stress tests, and our facility has the capability to do all of that stuff.
And I'm going to ask you about both of those in a little bit. Let me give out the information. I'll give out this office information again. It's South Florida Heart Institute, Dr. Jonathan Vafai, 5035, that's 5035 Via Delray, right there in Delray Beach. It's just north of the Boys Market. That's where I always see it. And then
1 block north of Lake Ida Road. That's the way I put it.
1 block north of Lake Ida Road, 561-637-0500. And as Dr. Vafai said, a part of Tenet Florida Physician Services, that's tfpsdocs.com. Dr. Vafai, one of the questions I want to start out, because people know I'm kind of a big guy. I played football. I never lost the weight. And I'm always wondering, I'm seeing my doctor all the time, every few months, because of the size. There's nothing developed yet, but at what age will an individual need a cardiac consultation? Is there people like me who should be starting to think about a cardiologist, or are you more referred, you more have patients that see you for maybe ailments that have developed and they're referred by their physician?
David, that's a great question. I see people of almost all ages, adults of most ages, pretty much anywhere from around 20 or 21 and beyond. I have a few patients that are above 100 years old. There's no set age where you should necessarily see a cardiologist. I do often see people who just want to get a checkup. We don't do general medicine, internal medicine, so we're not primary care doctors, but we have that training. So we'll check your cholesterol, to get a good thorough history, identify risk factors, see where things might be able to be improved. Certainly, if you have risk factors, it's more worth considering, as if you have diabetes, if you're overweight, if you have a strong family history of heart disease, arrhythmias, those sorts of things, it might not hurt to get checked a little bit sooner, so at least you have a relationship. See if you're comfortable with the doctor, and that way, if there is a problem down the line, you can give them a call.
Is now, you mentioned weight as a risk factor. Is smoking a risk factor?
Smoking is a huge risk factor. I used to be a pragmatist and not really push people too hard when they come in and they tell me that they're smoking, but I've seen it in my now many years of practice that very high risk for causing a heart attack, causing stroke, and when you quit smoking, it's a really good way to lower that risk.
I've seen this actually with my dad. He had a stent put in a few years ago, quit smoking. He's healthier than he's ever been, in my opinion. He's not a big guy like me. He's actually skinnier, but that's a story for another day. But I don't want to put you on the spot here, but what about smokeless tobacco? I'm talking about chew and dip, and then onto, I got to ask you, it's everywhere, these vapor tobacco things that people are, I've seen them in their cars, just the big puff of smoke comes out, but it's not actually smoke. I'm confused about that.
I'd like to think that any of those are safer, but the truth is that there's a lot of the toxins in the tobacco. So chewing tobacco or smoking pipe or a cigar, it's still harmful. It's a little bit less studied, but be best to try and get off of those things. Even the nicotine itself is a vasoactive substance, so it can cause spasm and cause other heart conditions. And as far as the vaping, that too, I'd like to think that it's safer, but they've been finding all other sorts of toxins in them that might make them harmful. So, it might be a little bit better, but I'd probably prefer you switch to chewing gum.
Definitely, yeah.
I understand how difficult it is, though. It's one of the toughest vices, and people who barely have enough money to pay for food or utilities are spending all this money on packs of cigarettes every day, and it's tough. I understand it.
You can't raise the price high enough. What about let's talk about, can soda be a risk factor? Can alcohol be a risk factor? Liquids that we put into our body.
It's being looked at. I know a lot of the sugary beverages are generally not good. It's a large source of carbohydrates and a lot of calories. So I'm not personally in favor of that. I prefer either just drinking water or carbonated water. And as far as the diet drinks, I try and keep those to a minimum too, because the sweeteners in like a Diet Coke still stimulates your body to release all these hormones that probably aren't that good for you. So, I may have a Diet Coke periodically, but I have patients who, between the caffeine and all the artificial sweeteners, they're drinking like 5 or 6 Diet Cokes a day. That's not very good for you.
No, definitely. And that's, I would tell people also, if I've used it lately, is I've been drinking a lot of water and then just unsweet tea. At first, it's a little tough, but you get used to it after a while, and it's better for you.
I think tea's great.
Oh, yeah, as long as you keep it unsweet. If you're loading it with sugar, then we get back to the thing there.
Maybe a little bit of lemon. That's
a good point. Or even lime in water or tea. I want to go kind of 360 backwards to the echocardiography. I've seen this term. I feel like the last few years I've been seeing it more, and maybe because you guys are doing more of them as cardiologists, or maybe I'm wrong there. But when is an echo needed?
So my specialty is non-invasive cardiology, so I deal a lot with echo. I'm the echo director of the lab at Delray Medical Center, and we find that we are indeed doing a lot more echoes than we used to. So there are several different types of echoes. I'm going to name 3 of the main ones. There's probably 5 or 6 other types that we can go into as well if needed. But the most common is what's called a transthoracic echo or echo Doppler. That's done in a doctor's office, or it could be done in the hospital relatively quickly, and it gives you a picture of the heart moving. You can see the valves, you can see the large areas of where the blood is moving. You can't really see into the smaller arteries, though. But this will let the doctor see if you have a leaky valve or a narrowed valve. And you could actually make a lot of measurements about the pressures in the heart and how efficiently the heart's working. Other types of echo that we deal with is something called a stress echo, where you go on the treadmill, you take a picture of the heart moving before you go on the treadmill and then after. That can tell indirectly if there's any blockages. And then the third type that I deal with the most is called a transesophageal echo, or TEE. And TEE is a test where it's generally done in a hospital, but as an outpatient, and you're put to sleep. And it's like an endoscopy that gastroenterologists would do. And you basically stick the camera down the throat where the food goes in the esophagus. And there's much less interference between the TEE camera, the ultrasound camera, and the heart. There's only about 2 or 3 millimeters of tissue. You could really see all the nooks and crannies and the valves. And we're using that test a lot to help guide interventional procedures, as some of my colleagues do, with these newer valve surgeries and closures and what's called structural cardiology.
I'm glad you mentioned that, because the Tenet Florida Heart and Vascular Network, who you are part of, was bringing on some big time physicians in the area. We have a new structural heart disease cardiologist we talked about, and then also a few new interventional cardiologists, and of course goes along with it, one of the top vascular surgeons in the world. Hold that thought, Dr. Vafai. On the other side, we're going to talk a little bit about nuclear cardiology, and I want to ask you about heart arrhythmias, because those seem to be skyrocketing in the news as well in terms of health, on how to stay healthy. How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DiPino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments and my curveball question of the hobbies and passions in life doctors pursue when not providing medicine. And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health. And we're back on How to Stay Healthy. We're here with Dr. Jonathan Vafai, cardiologist at South Florida Heart Institute, 5035 Via Del Rey, right over in Delray Beach. Numbers 561-637-0500. Or you can see Dr. Vafai's certifications, where he went to medical school, just about everything, internship, residency, fellowship, which I hope we'll get into, at tfpsdocs.com. Dr. Vafai, before the break, we were talking a little bit about echocardiography. Thanks for telling us about that, so we know exactly what it is. We talked about preventive cardiology. One of the things that I'm confused about is probably the first word there is nuclear cardiology. How is that helpful in terms of treating heart ailments?
Sure. We do subspecialty training in what's called nuclear cardiology, which involves the use of radioactive tracers, which help us because they generally travel with blood flow. So the tracers can tell us if you have a blocked artery, if you can tell us what the heart function is. So the most common use is for what's called a nuclear stress test. Other people might have heard of it as a thallium stress test, although we don't really use thallium anymore. And the person will give the patient an injection of a tracer, take a picture of basically the heart function, and you get these beautiful donuts pictures. They look like these circles, and you can see all the areas where the heart's flowing or not flowing. So if somebody's had a heart attack, it'll look like somebody took a bite out of the circle. And we'll have them on the treadmill or give them a chemical stimulant to get the heart going, and we give another injection. And we compare the before and the after pictures, and we can see what the situation is, whether they're blocked arteries or if everything's normal. It's very helpful when somebody's having chest pain, you're not really sure what the cause is. It's a good way to evaluate that and tell them whether there's a blocked artery or not, and help risk stratify people. They might have had a heart attack to see, how big of an area there might be at risk, and there are other new areas where there are problems. So something we use a lot, and it's very helpful.
I know some of the echocardiography is done downstairs at South Florida Heart Institute, and some of it has to be done in the hospital. Is that the same in terms of nuclear cardiology? Is some of it done there right at the institute, and the rest is done at the hospital, or is it all done at the hospital?
Both facilities, actually, we could do pretty much everything. There's some things we don't do as often in the office, and we might farm it out to the hospital, but our lab at South Florida Heart is pretty fully capable.
Maybe more serious cases probably go over to the hospital kind of thing.
And there are often times when we have somebody who's in the hospital and they need to be evaluated, and so we'll do the testing there.
Okay, yeah, definitely. And that's Delray Medical Center. Was just over there recently. That renovation is amazing. What they've done there.
It's beautiful.
It really is. And I haven't seen the helicopter land on the roof. Actually, the night that they were doing the opening night, I didn't have, my wife had a baby girl, our first girl, so June 29th. So I was actually invited by the CEO, but missed it. I wanted to stand on the roof.
There's some great photos of some of my colleagues up there. I was out of town myself. It was my anniversary.
Oh, wow.
But the new renovations really bring Delray Medical Center up to a whole new level. With many private rooms and great facilities, new cardiac rehab. It's a very exciting time to be a doctor in Palm Beach County.
Yeah, you're in a great spot. I know you know that, but with the 5 other cardiologists there and great hospital right down the street. We have a few more minutes. I really want to get into pacemakers and defibrillators. I'm learning a lot about pacemakers. I actually interviewed Dr. Fred Love, who's a Delray Beach resident, who had a lot to do with the first pacemakers around. I was interviewing him for a newspaper, actually, and he had pacemakers from different eras, from like the 60s and 70s and 80s, and he had them all lined up. It was amazing. But when is a pacemaker needed? What is a pacemaker? How does it work? Obviously, it paces the heart, I believe, but I'd love to hear from a cardiologist.
So there's certain situations where basically pacemakers needed for slow heart rates. And sometimes people actually have fast heart rates, and then we give them medications to slow down the fast heart rate, and then they need the pacemaker sort of as backup. So people might have an episode where they pass out, and then we later discover that just the wiring in the heart isn't working well enough. So a pacemaker is there basically as a backup mechanism. And oftentimes, your heart's own natural pacemaker is doing what it's supposed to, but it just can't get the signal through. So the wiring and the little computer and the pacemaker listen for that, and if what is happening is not supposed to be happening, the pacemaker then kicks in. So it doesn't slow down fast heart rates. So that's what a defibrillator is for. There are people who've had heart attacks, and because of scar tissue, the heart beats very, very fast, so fast that it actually seizes up. It's what's called ventricular tachycardia or ventricular fibrillation. And that can cause you to basically drop dead. And just like the paddles that you might find at the airport or in public places these days, an internal defibrillator is there to prevent your heart from stopping like that, and it'll deliver a shock, a little bit less energy than the paddles would, but enough to get the heart reset and get things going. So those have been shown to help people live longer who have weakened hearts. So defibrillators can function as pacemakers too, but pacemakers are just pacemakers. They don't do any heavy-duty shocking.
And how does it work in terms of your work on the treatment there? So I believe a cardiac electrophysiologist probably puts this in, and then you monitor it over time. Is that how it works?
Yes. So our office doesn't put in pacemakers. We've chosen to work with other doctors who even subspecialize and just do that. On Tenet, we have Dr. Weissman and a few other specialists and some surgeons that are very good at it. And once the pacemaker's put in, we generally take over the care. We specialize in doing all the programming and the monitoring and the analysis. So pretty much up until when the battery needs to be changed, we're the ones who deal with the day-to-day or week-to-week issues, if there is one. Generally speaking, once a pacemaker's put in, you get it checked every 6 months or so, which we can do in our office. And it's pretty much something you can forget about.
So that's an office visit. They come about every 6 months.
Right.
And you're able to,
You do routine, a physical exam and whatnot, but we do it's a quick visit where we use a wireless computer, and it will talk to the pacemaker and tell us what's going on and the health of the computer and the wires and the battery, so we can be proactive and deal with any problems before they start to bother anybody.
Now, another heart rhythm issue that's really come in the news the last few years is atrial fibrillation. And I'm going to ask you here, I've had a couple patient testimonials where a couple of people have said it's like they had a bird in their chest, but then I've heard it described different ways as well. Is a heart arrhythmia what causes atrial fibrillation? And then also, if you would share with us exactly what is a heart arrhythmia?
Arrhythmia is an irregular heartbeat. You can have arrhythmias that cause your heart to beat fast. There's some arrhythmias that are regular and some that are irregular. There are all these different classifications. I'm not going to bore you with all those details, but AFib is the classic description of it is irregularly irregular heartbeat. And in fact, what's happening is in the top chamber of the heart, it's beating very, very fast, upwards of 300 or 400 times in a minute. And the top chambers of the heart don't beat so well. They're actually also, like I described that other problem, seized up. And the blood doesn't move as well. And the bottom part of the heart just tries to keep up. And some people's hearts beat very fast from it. And some people actually wouldn't even know that there's anything going on that's different. And people can feel nothing. I've had to convince people that there's something wrong and to deal with the treatment.
Which can be tough.
Which can be tough. And then I have other people who they get, 5 seconds of AFib and they come to me in tears and they say, sometimes it's a blessing that you at least know that there's a problem. So when we treat it, we can know that it's getting better. But there are other times where it's silent, and we can find out that you had AFib after the fact because AFib is a big risk factor for a stroke, and that's a lot of what we end up dealing with in the hospital for people who've had strokes is trying to catch whether there was AFib there, and it's a growing field. And I don't know if you heard the latest iPhone announcement. The iPhone's going to now potentially diagnose people's AFib based on the heart rate monitor with the Apple Watch.
Oh, wow.
It's going to be a big deal.
The new iPhone X that they're talking about, maybe?
And then the Apple Watch.
Wow.
Well, I think all the Apple Watches might be able to do that.
That's on my list, is the Apple Watch.
I really want a little bit nervous because we're going to be getting all these people from the Apple store or something complaining that they have AFib.
But they're Googling conditions anyways. I'm sure they're coming to you with all kinds of self-diagnosis. I think we all do that nowadays a little bit before we go and see the good doctor. So AFib, I got to tell you, as a cardiologist, you're doing a great job getting the word out on how AFib could lead to a stroke, because I tell you, a few years ago, I only associated stroke with neurology issues, neurologic disorders. But a stroke is a brain attack, but it has to do with the heart as well.
It very well can, and vascular disease. So there's a lot of overlap with between us and the neurologists in dealing with reducing risk factors, lowering cholesterol, getting people to stop smoking, and then diagnosing arrhythmias that people may or may not even realize that they're having.
Let's stay on that topic of vascular disease. Is peripheral arterial disease a form of vascular disease, and how is PAD treated by a cardiologist?
PAD is basically cholesterol plaque or blockages that develop in other parts of the body other than the heart or the brain. And cardiologists, part of doing a full physical exam, are going to examine your pulses and how the blood flow is and get a good history. Do you get soreness in a leg, or one leg or the other, or anywhere else in the body to diagnose whether there's a blockage. So we work a lot with our vascular surgery colleagues like Dr. Ricotta, who's also part of TEN in diagnosing and treating peripheral vascular disease these days.
We only have a minute. Let's play a quick game here. Yes or no answers. Can a hurricane affect the heart?
We've been seeing in this past week the hurricanes causing people to get pretty stressed out, and there is a condition called broken heart syndrome, and certainly could cause a problem, can cause arrhythmias. I Tuesday morning had one of my patients come in with AFib, actually, probably from the hurricane.
Unbelievable.
All sorts of problems from Irma.
Well, thank you so much, Dr. Vafai, for sharing all this great information with us. I really appreciate it.
My pleasure. It's an honor to be with you
And
today.
come back to the show. That's Dr. Jonathan Vafai in Delray Beach, South Florida Heart Institute. Thank you very much. Good night. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not